nursing programs are sterile. They really don't have to be. Nursing students, as well as some nurses, are intimidated. They don't have to be. I think if we can inject humor and real life situations, there's a stigma that nurses eat their young. Sometimes we do, and I think that if we can show nursing students, nursing instructors, how to treat each other, then they won't go out and eat their young, so to speak, when it becomes their time to teach and bring other people in. And it's just a way to just kind of bring everybody together, show everybody that we are real people. We like to laugh, even though we have those media concepts of a nurse ratchet. We're not like that, but I think that when people think about us like that, sometimes we project ourselves that way, and I think this is a way to show that we don't take ourselves too seriously, even though the situation is serious. So just a way to come in and show that humor and to help the students learn, because you don't learn in situations where you're intimidated. So as long as you have humor, as long as you have games, you're willing to learn and willing to do more.